Good afternoon, everyone. Phil Penarski here with CBS 42 Now. Very quickly, as we get set to send you right on over to UAB, UAB will be joined by leaders at local hospitals as well as the Jefferson County Department of Public Health as they give a Q&A session regarding the ongoing COVID-19 pandemic. We will send you there live right now as it appears they are underway.
Opening statement from each person, and once we begin the Q&A portion, ask that media drop their question in the chat box for us to ask. Just trying to minimize any confusion. I will moderate and ask questions on the behalf of media outlets. If you have a question for a specific facility or representative, please specify. Once we get through those statements, we will open it up. Today we have Dr. Mark Wilson, Health Officer, Jefferson County Department of Health, Dr. Timothy Bodie, Chief Medical Officer, Ascension St. Vincent's Hospital, Dr. Elizabeth Ennis, Chief Medical Officer, Brookwood Baptist Health, Tom Schuffelbarger, CEO of Children's of Alabama, Dr. Jeremy Rodgers, an ER physician and Director of Clinical Services at Grandview Medical Center, Jennifer Snyder, CEO, Hillcrest Behavioral Health Services, Keith Pennington, CEO, Medical West Hospital, and Anthony Patterson, CEO of UAB Hospital. With that, I'm going to open it up to Dr. Wilson to begin, and we'll call on other representatives with their opening statements here in just a moment. So Dr. Wilson, you can take it away.
Hello, everybody. It's really my honor to be on a call with these hospital leaders. They represent our healthcare heroes. I think you all remember when we made a big deal out of celebrating our heroes. We're in a big, scary surge right now. It's the fourth time around. I know we're all really tired of this, but these folks represent our hospitals who are dedicated to taking care of you when you need them. So I really want to encourage all of us, the rest of us, to do our part to be there for them. And the most important thing we can do right now is to get vaccinated as soon as possible if you've not yet done so. And while things are really bad, as they are now, we need everybody to mask back up, get back to the basics, masking, social distancing, washing your hands, avoiding big crowds. I know this is hard, but it's hard on everybody, especially our healthcare workers. Thank you.
Thanks, Dr. Wilson. Dr. Bodie?
Yeah, thanks for the opportunity. I'm Tim Bodie. I'm the Chief Clinical Officer for Ascension St. Vincent's Health System. And I'll just take a minute to let you all know how proud I am of our associates, our nurses, our doctors, and everyone that's working in our hospitals and clinics. They're doing an amazing job and their commitment is incredible. So I wanted to make sure I stated that first because I don't know what we would do without them, and their service to the community is amazing. We're feeling the surge and it's real, and our census is continuing to go up, and we have a looming sense of what occurred back in January, and it's a little concerning to understate it a little bit here, but we're approaching 100 patients, 100 COVID patients in all of our hospitals right now. What we know is 88% of those patients in our hospitals are unvaccinated. Those that are on the ventilator and in critical care units that are extremely ill, 93% of those are unvaccinated as well. We've seen in our hospitals a 700% increase in COVID cases in just the last 3 weeks. Our EDs are extremely busy, and we're seeing a lot of patients there. The thing is our hospitals have been busy prior to this mini surge, so it is having a significant impact on us and on the community, and we just ask that you get vaccinated and that we increase vaccination throughout the Birmingham and Alabama area to really help our healthcare workers, our hospitals, and to prevent this disease from getting any worse.
Thank you. Dr. Ennis? I believe you're muted. I'm gonna make sure you're muted.
Thank you. Thank you very much for allowing me to join this group today to represent our nurses, physicians, and other healthcare providers at Brookwood Baptist Health. We too, like Dr. Bodie and all the other leaders on this call, are seeing incredible surges of COVID-19 patients. And we too have ICUs that are busy and full, are converting ICUs that were formerly not COVID units to current COVID units, and trying our very best to take care of the patients in the surge from COVID-19, as well as those Alabamians who still need ongoing health care from important day-to-day things like heart attacks and strokes and needed surgeries and things of that nature. We cannot thank our healthcare workers at the bedside enough. We have lost many of them in Alabama to travel to go elsewhere, and we desperately need them to come back and serve their fellow Alabamians during this pandemic. I want to reiterate the comments that are already made, that we are hopeful that Alabamians will lead by example and increase the vaccinations, the shots in the arms that we have in our state here, so we can really defeat this pandemic for Alabama. What's different this time, and I'll end with that for favor for the others, is that we are seeing much younger people in the hospital, much younger people without so many comorbidities or comorbid conditions. And it's tragic for our nursing staff to care for individuals their age and the age of their children who are unfortunately critically ill and dying this time around.
Thank you. Tom Schuffelbarger?
Thank you, and I'd like to just add to it. We're seeing the same sort of surge here at Children's, where our COVID volumes are back to where they were during the peak of the pandemic, and that's on top of a time when we're setting record activity levels this summer in inpatient and emergency department and ambulatory. So it's coming at a bad and stressful time for the organization anyway. We've seen an uptick lately in our staff testing positive. We've had as many in the last week as we had in the months of May and June combined. We've had 25 employees test positive. So that's also frightening as we look forward. And I'd like to also add and echo the recommendation of our medical leaders here, which is to please get vaccinated and get your children that are eligible for vaccine vaccinated. It is it's more important than ever now. Thank you.
Thank you. Dr. Rodgers?
Good afternoon, everyone. I'm Jeremy Rodgers. I'm the Director of Clinical Services at Grandview Medical Center, but I'm also a full-time emergency physician. And so I can testify to kind of what we've seen as far as our trends with COVID-19, but also what I'm seeing at the bedside, and certainly very concerned about what the direction that we're headed. Over the past month, we've really seen our COVID hospitalizations at our facility double about every 7 to 10 days. Indeed, our volume has increased over 500% over the past month. But like Dr. Ennis shared, we're seeing a trend toward the younger and the unvaccinated. So that's what we're seeing now. And if you look at our trends, we're seeing that same exact thing. If you go back to our large surge that we had this past winter in January, a majority of our patients were over the age of 60. And currently, as we sit now, over the past couple of months, we've seen that shift where a majority of our patients are now younger than 60. Indeed, 57 to 66% of our patients in recent months are younger than 60. So majority of our admissions are younger. We've even had a 19-year-old admitted to the hospital yesterday with COVID-19. So this is absolutely heartbreaking what we're seeing. It's tragic, and unfortunately, it's largely preventable. And so with regards to unvaccinated and vaccinated, we've in that shift we've seen toward the unvaccinated. 92% of our current admissions are unvaccinated. And so vaccination definitely affords that protection against being admitted to the hospital. Indeed, I took care of a husband and wife recently in the emergency department. The vaccinated husband brought his unvaccinated wife to the emergency department. And unfortunately, she had severe COVID pneumonia and low oxygen levels, and she was being admitted to the hospital. So I've seen this play out within families. So the bottom line is get vaccinated. I've seen a lot of, we've talked a lot about vaccine hesitancy, but I've seen a lot of vaccine regret in patients that, and family members that wish they would have been vaccinated sooner. Vaccines are widely available. And so now's the time to get vaccinated before it's too late.
Thank you, Dr. Rodgers. Before I move on to our final three speakers, just a reminder to media to please mute yourself if you are not involved in speaking. And then once we get to the Q&A portion, we are going to have questions dropped in the chat and I will ask them on behalf of the media outlet to minimize any confusion and multiple voices. Jennifer Snyder.
Good afternoon. Thank you very much for getting this together. We kind of have a different position here at Hillcrest because we are solely for psychiatric treatment. But we saw with the last few surges that we had that there was a ripple effect in people being able to get mental health treatment. So we want to encourage the vaccinations as well. Oftentimes people that have a mental health crisis are going to the ERs or calling 911. And as we know, the ERs are absolutely overloaded with people who need medical care. And 911, the ambulances are overloaded as well. So we are encouraging people to use the crisis lines, call your community mental health centers, do your best to try to get people vaccinated and using your mask and the social distancing so that we can avoid future crisis with the mental health community. Thank you.
Thank you. Keith Pennington.
Good afternoon. I'm Keith Pennington from UAB Medical West. Thank you for the opportunity to share some of our current experiences that we're all going through now. And I'd like to start with, same as the others, I really appreciate and want to thank all of our healthcare workers. If it wasn't for them, we wouldn't be making it through this. But also want to recognize that they are stressed. Just when we thought a time was that things were getting better, we're seeing it almost worse than what it was or getting there. So very concerning for them. So if you see a healthcare worker, please thank them for all they're doing. Just some experiences we're having here, like everyone else. Our ERs are getting overloaded. Just personal experiences here. We don't have critical care beds. And so we are housing critical care patients in our ER. As recent as yesterday, we were working with less than 40% of our ER rooms because the rest of our rooms are occupied with COVID or our patients. And like was mentioned earlier by Dr. Bodie, here too, 90% of the ones that are COVID patients in the hospital were not vaccinated. The ventilator patients that are COVID, they're all not vaccinated. So we really are seeing more symptomatic patients of those that are not vaccinated, which really stresses the need to get the vaccination, because what we're seeing is people that are vaccinated but have had breakthrough COVID are not seeming to have the same symptoms of those that have not been vaccinated. So again, really stressing the need for getting the vaccination. Thank you.
Thank you. And we will conclude the opening statements with Anthony Patterson from UAB.
Hey, good afternoon, everyone, and thank you all for bringing this together, Savannah and Bob. I guess I'd start here at UAB Hospital, like all the other healthcare facilities, and you have heard it from others today. Our staff, our providers, they are stressed. They're experiencing, various levels of burnout. And this makes it even more and more challenging to provide medical care to our patients with COVID, and then to essentially all the patients that come in, even with non-COVID illnesses. One of the things that makes this surge a little bit different for all of us is that our starting point is more diminished than what it was, say, last December and January. Our staffing shortages are far more severe today than what they were back then. I think many hospitals, this is definitely true for University Hospital, our overall volumes outside of just the number of COVID patients at the starting point were above our pre-COVID era. So we've got a lot of patients that are still coming to the hospital seeking care for non-COVID reasons. And as we fill up our nursing units with patients who are in the hospital solely for COVID, then that puts pressure on us to be able to provide the rest of the care to the community. And particularly, we find that concerning at UAB Hospital because we tend to end up being a site of referral for so many patients that reach a certain degree of complexity or specialized services that are only available here. One thing I'd like to comment on just statewide, and these are some of the data that we got from our School of Public Health. So in October, November of 2020, it took us about 8 weeks to go from 750 hospitalizations to a total of 1,600. For this current surge that we're in with the Delta variant, the surge took 10 days to make that same leap in volume. So how does that then look within the hospital? 1st of July, we had 34 patients that were admitted with COVID. As of this morning, we had 105. and 83% of those admitted patients are documented as unvaccinated. And about a third of those are in the ICU, and 100% of them have the Delta variant. So I guess my final message would be, please encourage the public to get vaccinated, to socially distance, to wear a mask in order to help reduce the spread of the virus. Thank you.
Thank you. And just a reminder to all on the call, we do have a mixture of CEOs, chief medical officers, physicians. So we do have a blend of experts who can comment on a bunch of different topics. The first thing that was sent to us is what's different now in comparison to March 2020 and December 2020? You know, we've had different phases of the pandemic, and what we're seeing now, how is this different than past surges? And you all have touched on this a little bit, but worth reiterating some of the key points we're seeing in our hospitals. I don't know who would like to take this first.
I'll jump in for you there on that one. I think what's really different now is that back in March of 2020, we were facing a completely unknown pandemic, wherein we didn't know if our policies, procedures, practices, and our PPE would protect our employees and other patients in the hospital. We now know that those policies, procedures, and practices do protect our employees, our caregivers, and our other patients in the hospital. And we've learned an extraordinary amount since March of 2020. From the medical perspective, what we are seeing now with the Delta variant is that because it's so exceedingly easily transmitted from individual to individual, and that those individuals that have been vaccinated can have asymptomatic or very mildly symptomatic infection if they happen to be one of those breakthrough individuals that is just moving like wildfire. And you heard Anthony Patterson's comments about the doubling of the hospitalizations in the recent weeks. So the slope of the line, the ramp up of the infections has just been incredible as compared to last time. And again, the demographics are a little different. They're younger, they're not as natively sick, meaning fewer comorbidities, and we're having some tragic losses in the younger age groups that we just didn't see.
Yeah, I can add to that a little bit as well.
Make copies and then stamp.
Hold on one moment. Can everybody be muted that's not speaking? Thank you so much. Go ahead, Dr. Bodie.
Yeah, Dr. Ennis is correct and makes very good points. And just, you know, a couple of other thoughts there too is, I mean, our staff right now are exhausted. So we're facing a new surge with exhausted staff and with the labor shortage. And so that just piles on top of everything else that she just mentioned that's facing us. But I will say this, another big difference that we have right now is that we have a vaccine, and we didn't have that back then. And so we actually have a very effective, proven tool to fight this. And so I'll just reiterate the message. We actually have something to do now that we didn't have in the past.
Thank you. Dr. Bodie, while we have you, a few folks have asked a few questions about Ascension's vaccination policy. I'd like to open that for you to share more.
Sure. Ascension nationally has taken the approach to lead with safety and quality, and has really joined hundreds of other hospitals across the country in requiring vaccination for their associates and those that work in the hospitals, and for those that work in Ascension in general. So that's the position that has been taken and is moving forward. For us in Birmingham, we are part of the alliance with UAB, and we are working together with UAB and having our own conversations about how we are going to proceed towards that decision. And we're going to make that decision in the next week and make an announcement about how we're going to proceed. So we're doing that locally. Even though the Ascension message did come out about what they're doing nationally, we'll be making a local decision and getting you some information about that in the next week.
Thank you. And a few outlets had asked that. Kim Chandler from the Associated Press, this is for a few different folks, but how soon until our ICUs feel overwhelmed? And the second part of the question is understanding the number of patients who are in hospitals. So starting off with the ICU overwhelming question, if somebody wants to take that, are we there? Are we getting close?
I can respond just from a UAB perspective. We have multiple types of ICUs, a total of 219 beds. And the way that I believe most hospitals are taking care of COVID positive patients is that they designate a certain number of beds or an entire unit to cohort their COVID positive patients. So here at UAB, we have currently 2 of our ICUs fully dedicated for COVID care. That's a 25 bed unit and a 17 bed unit. And then the methodology, you just have to simply keep going to the next ICU or ICU equivalent space and continue to house more and more patients. So all of us have surge strategies where we have marched out how we're going to consume hospital space for COVID care. So for UAB, we have identified, we've got 2 units currently. We've identified up to a total of 4 that we would ease into from an ICU care perspective. We are seeing here about 2/3 of our patients are acute care and about 1/3 of them are ICU.
Thank you. Does anyone else want to chime in on the ICU overwhelmed question before we take the second part of Kim's question?
One thing I'll just quickly add is that, we're seeing the same thing at Grandview as far as the demand on our ICU beds. And as far as our capacity and ability to take care of patients, the more COVID patients you put in the hospital, it's almost like a vice grip on the hospital, and it really hinders your capacity to take care of every other patient that comes in. And so again, as we continue to see the number of hospitalizations grow in the community, it certainly puts a lot more strain and stress on an already stressed and strained system. And so that's what we're experiencing right now. And unfortunately, I think we're all afraid that it's going to get worse in the coming weeks with what we're expecting to come. And so it's just something that we're going to have to adapt and adjust to like we did last time.
And Dr. Rodgers, while I have you, and this could be for any of the other physicians, but Kim asked, patients that are presenting at the hospital, how many are testing positive when they actually came to the hospital for something else? And what does that look like? Is it safe to presume that number is small and most people are still presenting with those COVID symptoms that we've been hearing about over the past year and a half?
I think since we're on the uptick of this COVID wave, we're still, most of our patients that are coming in are sick with COVID-19. The vast majority are. We saw that last time with previous surges, particularly our December, January surge, where we had some incidental positives, but the vast majority of our patients are coming that they're sick with COVID-19 and they're having issues related to that.
Thank you. A few people have asked questions just about employee burnout, employee stress, how employees are faring at all of our facilities. So that can go to really anybody. Is there someone who'd like to start off with just kind of the state of employees and morale at their hospital?
I'll make a comment. We've all, I think, said that our staff are tired. They're stressed, various stages of burnout, depending on what their personal experience is. And so it's a daily challenge to make sure that they receive encouragement, feedback, and support everywhere we can. Here at UAB, we are fortunate. We have a fairly large pastoral care force, and so they are good at helping us to keep a pulse on the staff and be supportive and available to them. But the whole, sort of return of COVID as a surge phenomenon, it's really had a very negative effect on how our employees engage every day, knowing that a lot of this was preventable with vaccine and mask wearing.
Thank you. Does anybody else want to chime in there?
I agree with everything that Anthony has said. I think that they are exhausted. They are resilient, however. And every hospital in town is doing everything that we can do to help support our staff at the bedside. What we can do as a community to support our staff at the bedside so that there's someone there for you when you have either your COVID or your non-COVID related illness is to get a vaccine. So we can move back more toward normalcy in the very near future.
Thank you. To piggyback off of that slightly, Michael Clark from CBS 42 asked, what are some of the recruiting efforts that different hospitals are using to bring nurses back or bring new healthcare workers in if we're seeing some sort of a turnover in our facilities? Is there a person who'd like to comment on just anything that's working in your areas? Anybody want to comment on that? If not, we can move to.
I can tell you that the chief nursing officers are individually working with and talking to candidates themselves. Every one of these hospital systems has employed strategies to try to recruit nurses back to Alabama and to retain the excellent bedside staff that we currently have. So that takes a lot of different forms. It takes forms of monetary compensation. It takes the form of respect and recognition. We have enlisted our medical staff to voluntarily help supply some of that reward and recognition to our staff, just to tell them they realize how very hard they've been working. That every single facility in town has and will continue to work very diligently. And a group of unsung, heroes for part of this are chief nursing officers and their staffs who are looking at nursing ratios and positions to fill literally on a daily basis, and sometimes twice and thrice daily, quite frankly.
Thank you. We have gotten a few questions just generally about hospitals having to cut back on elective procedures, surgeries. Are we at that point? What's that threshold look like? And are any facilities getting to that capacity limit?
Happy to start on that one.
Great.
So we're going to be moving to preoperative testing of our surgical patients next week. But we don't have any plans at this point to limit or stop any surgeries. We're hoping we don't get there. I think when you're in the middle of a pandemic, you have to realize that everything is on the table that you've got to consider to run your hospitals effectively and safely. And so we're not there now. I'm worried with the rapid increase that we're all seeing that we might be at some point in the near future. But let's just hope and pray that this doesn't get to that level.
To piggyback off of Dr. Bodie, we're doing the same. I think all hospitals are having to monitor what the bed needs are for the patient following surgery, what our resources are. But right now, I think we're all trying not to go away from doing elective surgeries, but we all know that is a possibility given where we head with this going forward.
Thank you. Going to the emergency room right now is a big topic. A lot of folks are not sure if they're sick enough to go to the emergency room. Some people are delaying care. They're not going for serious needs where they might need to be going to the hospital. Alternatively, people are showing up to the hospital when they maybe could go to an urgent care clinic or do telehealth. Could somebody be able to talk about what that surge at the ED looks like right now and kind of give just a little bit of background for the audience of when to go to the emergency room and when to seek care?
Guess I'll field that one. So certainly every hospital, every emergency department in our area is feeling the strain right now. As hospitals fill up, as ICUs fill up, as we get more and more COVID patients. So our emergency departments fill up, and it makes it more and more difficult to be efficient and to be fast and to really get people moved in and out of the emergency department and get them the care they need in a timely fashion. So right now, I'd say our area emergency departments are certainly strained, and we definitely are approaching capacity limits. But what I would tell anyone is that if you have an emergency, you feel like you have an emergency, go to the emergency department. Do not delay care. We've learned this previously with different surges of COVID-19 that we cannot afford to have patients delay care when they need it. And so, I can tell you at Grandview, we have certain processes and protocols we've put in place, even under strained and stressed circumstances, in order to deliver care as efficiently as possible. Now, and again, so I think if for the general public, they may experience a little bit longer wait times when they go to emergency departments right now, but almost all of our facilities are doing things to try to get to patients as quickly as possible. And another thing I would mention too is that every emergency department has a triage process, and so as soon as you sign in and come to emergency department, you're evaluated very quickly, generally, to identify whether you actually have emergency or not, and we try to triage patients based upon how sick they are when they come in. And so, it's a conversation you can have with your doctor, if you're your primary care doctor, and to walk through if you have symptoms or some medical condition that needs urgent attention. But again, I think all the area hospitals would stress that if you need to come to the emergency department, please do not delay care.
Thank you. Jennifer, Snyder, I'm going to turn to you. You all are specifically seeing the effects of an overcrowded emergency room system. Can you just comment on how that ripple affects other aspects of care that the community can receive?
Yes. So with the mental health, a lot of times they go to the ERs in order when they're having a crisis, or call 911 and the ambulance will pick them up and take them to the ERs. And then in the ERs, they triage them, they find the best place for them to go, and they send them out. Or many of our med surges have their own psychiatric departments, but with the backlog of the people that are coming into the ERs, it's slowing that process down. So people that are in crisis, oftentimes they won't wait in the ER for the care that they need, because of course they're going to meet the medical first. And so they may leave, and that's going to have that ripple effect on the mental health. We saw a lot of it last time. Our census kind of plateaued here, and then we had COVID go through our facility last year, and it went through with the staff and the patients. And when you have people that are in mental health crisis, and then you add on COVID and trying to explain that to them, it's very difficult. And when that happened and it went through those surges in the community, you had less people coming in and getting the care that they needed. So then we've had different surges with mental health. And we all know with the kids going back to school and they had been out of school for so long, it often causes a rise in some of the adolescent anxiety, depression, and things like that. So it's going to be an interesting fall to add this surge into everything without what we have going on. And the staff are very stressed, as you mentioned that earlier. It's very difficult to go through all of this on their mental health as well.
Thank you for giving that context. This can be for anybody. Are you all seeing a difference in how the Delta variant affects patients in terms of severity of illness? We've heard it's more contagious than the original strain of COVID-19. What are we seeing presenting with patients?
Well, we are still seeing a lot of COVID pneumonia, and we are seeing COVID pneumonia that requires very aggressive intensive therapy in people that are young, that we didn't see before. 20-year-olds, 29-year-olds in the ICUs on ventilators with extracorporeal membrane oxygenation, or ECMO, meaning machines oxygenate their blood so that their lungs can rest. It's different. So the presentation is essentially the same. There are just many more of them, and they're younger.
not being a physician and looking at it from that perspective, I would say that over the course of the various surges that we've had, the number of patients coming into the hospital that end up favoring being in the ICU versus being on acute care, it does sort of move around. Early in the pandemic, we had more of our patients hitting the ICU. I think, part of that was perhaps they were didn't seek care soon enough because they didn't really know. We didn't have a lot of testing. At one point, it was roughly 50-50, but right now it's predominantly acute care. I don't know that the patients today are much sicker than what they were before, but certainly those that are in the ICU are very sick.
Thank you. From WBHM, this is for Dr. Wilson directly. When we saw previous surges, there were mask mandates and restrictions on gathering in groups, eating in restaurants, etc. Are you considering implementing those kinds of public health restrictions now?
Now, we are strongly recommending that everyone in all indoor spaces where there are other people wear masks. That's universal, whether you're vaccinated or unvaccinated, and we strongly recommend that. I have no current plans to issue an order, but we are talking with elected officials and just trying to get everybody on board with encouraging our public to do the right thing, trying to encourage businesses to put the signs back on their door to ask people to wear masks. And that's our approach right now.
Thanks. And another question for you, Dr. Wilson, just in speaking about expanded community testing, so that the public doesn't overwhelm our emergency rooms and places that are trying to provide care to a wide range of people. How can folks get tested? What are some options? Can you just talk more about testing in general?
Yes, we are concerned about that also. There are plenty of places that you can go get tested, such as pharmacies and some of the urgent care centers. And our health department is again looking at ways to increase that capacity. So that's what I would encourage you to do. Do not go to an emergency department to be tested. Just go to an emergency department if you're really having serious difficulty breathing or other symptoms that might represent an emergency. But it is a concern right now just because this is changing so rapidly. There are some take-home tests that people can do either by mail order or through a pharmacy that they can buy off the shelf. The main concern with that is we're not certain that all of those are being reported to public health for us to do contact tracing. So if you do test positive, please be sure to notify the health department or at least notify your health care provider so that that can be reported, because the contact tracing is very important. We also want to remind people that if you are positive for COVID, you do need to still isolate for the 10 days. And if you're exposed to somebody, you still need to quarantine. So please be cognizant of that so that we can prevent it from getting spread around to other people.
We've got several other questions trying to go through. Thank you, everyone, for your participation. One thing you just touched on, Dr. Wilson, and I'd open this up to any physician as well, just reminding people about getting tested, knowing their symptoms. We are hearing about breakthrough cases in vaccinated people. So when should someone get tested? What are those symptoms to be looking for? We've talked about this for many months, but just a reminder now that we are seeing more cases in people who presume to be protected. Any MD wants to take that one?
I'll take that. I think we've been through different surges of this pandemic. I think the general public is aware of a lot of the signs and symptoms of COVID-19. It certainly can manifest itself in a variety of ways, most commonly with upper respiratory congestion, cough, fever, chills, body aches, fatigue. One of the telltale signs of COVID-19 infection is the loss of a sense of taste and smell. In fact, I've seen a few patients that's about all they have with COVID-19. If you have any signs or symptoms that suggest COVID-19, you need to be tested. I've talked to personal friends taking care of patients where they have milder symptoms, and they need to be tested because if they have COVID-19, they potentially put other people at risk of contracting COVID-19. And that's what we're seeing right now with this stage of the pandemic, this new surge, is that we have younger, unvaccinated individuals that may in fact have milder symptoms, have a milder presentation, but then they spread it among their family, their friends, and cause kind of a mini outbreak around their circle of friends. And they put the people that are older, in their 40s, 50s, and certainly anybody over the age of 65 at risk of developing severe COVID-19. And so we're under a big surge right now in COVID cases. They're multiplying in the community. The number of positives that we're seeing in the community is back to very high levels. And so I would just encourage anyone, if they have any signs or symptoms that suggest COVID-19, that they be tested as soon as possible.
Thank you. This is for Tom Schuffelbarger. We're hearing just about a lot of new cases in children and children's hospitals starting to see the effects of COVID-19, whereas in the past, children seem to be more protected. Can you comment on what you guys might be seeing and just what folks in the community should know about the virus and it presenting in children?
Sure, and as I mentioned, our experience today, we're as busy with pediatric inpatients as we have been throughout the pandemic. Probably, I think yesterday we had 14 inpatients, or 2 weeks ago we were down to 4 or 5. Still, a majority of those children are diagnosed as positive when they're here for something else. Only a couple of them are truly here being treated as an inpatient for COVID symptoms, but when they're here for appendicitis or for some other issue, we're testing everybody and finding them positive. So it still puts an additional strain on our resources caring for them. And it's indicative of the continued growth rate in the community. Hopefully, kids generally aren't getting as sick from it, and that will continue. But the Delta variant's new, and our doctors are watching that. It's also frightening in that still under 12 children are not eligible for vaccine, and we don't think that's on the horizon anytime soon, maybe towards the end of the year or by the first of the year. So that's still a vulnerable population, and there are, against the backdrop too of being very busy, RSV, typically a winter virus that affects a lot of children, puts a lot of people in the hospital. We've had a hospital very active with RSV being diagnosed and putting children in the hospital for most of the summer. We had a higher level there than we did of COVID. And so again, it's additional strain on an existing patient, regular patient level for us. It's probably more frightening than it was back in January and February.
Thank you. I know that everyone on the call is in agreement that the vaccines are safe, effective, and our best way to beat this virus and to move forward. One of the questions was directed at Dr. Rodgers, so I'll let you take it first, but could be open to several folks on the call. Just about vaccine regret and hearing patients who it's too late. They are already in the hospital and they're asking for the vaccine. So without giving too many details on a specific patient or circumstance, can you, Dr. Rodgers, start off just by giving an example of what that vaccine regret looks like and what you're hearing and seeing and just why it's so important to get vaccinated? And I open that up to anybody else as well.
Yeah, I mean, that's what makes this whole situation heartbreaking. And, and having these conversations with families, with patients, their friends that bring them to the hospital, because the vaccine is so widely available and it's been available for a long time now. And we've all seen this in the news and on social media and a lot of different places where, we have individuals, we have our own friends that have contracted COVID-19 or spread it to other family members. And it's unfortunate, having these conversations. But what I'm encouraged by lately is I've seen some recent upticks in the number of vaccinated individuals in Alabama. And I think it's a result of what we're seeing in the hospitals. I think that some people are getting the message. We need a lot more people to get the message to get vaccinated to prevent the spread, the continued spread of COVID-19. But I think a lot of us who are working in healthcare right now and taking care of patients at the bedside have had these conversations with families and patients that come in with COVID-19. It's just, again, once you know someone that gets admitted with COVID-19, that should be encouragement enough to get vaccinated if you're unvaccinated.
Does anyone else want to echo that?
I think he said it very eloquently. We would all agree.
We are pushing up against about that hour mark. So I'd like to end perhaps on everyone kind of going through a best case and worst case scenario for the next few weeks and months, meaning best case scenario, what you think we can do as a community and what people can do to get us out of this situation, and a worst case scenario, what your facility may be looking towards or planning for as a surge continues. I think that would be a good way for everyone to end. I'll kind of round robin it again.
I'll start from the UAB perspective. I think best case scenario is that a lot of our public respond to get the vaccine, modify some of their behaviors, help the community have a decrease in the spread of the virus, decreased hospitalizations, that we stabilize somewhat. If you look at the growth in the number of COVID positive citizens within the state, it is shocking what the growth curve looks like. So best case scenario is we suffer through a few weeks and then it starts to lighten up, and maybe we get back down to a baseline. Worst case scenario, our School of Public Health faculty, Dr. Suzanne Judd, had done some projections using the current spread that's occurring in South Alabama. Using that data puts us at a total hospitalized count for the state as a projection, it's a model, at around 7,000. So that would be, continuing in that direction where we have more and more and more patients being admitted to the hospital. Every hospital in the state would be challenged to be able to keep up with that.
Thank you. Does anyone else want to chime in on kind of the best and worst case scenarios?
Sure, I will. The best case scenario obviously is to get people vaccinated, and for people to think of it as not only perhaps caring for themselves, but very importantly, in a very philanthropic and religious state, to care for others in a way, in the ways that Dr. Rodgers alluded to before. Another way to look at it in a worst case scenario is frankly that we fail to achieve vaccination and control. And the virus mutates, and then it becomes a virus that is not controlled at all by any of the current vaccines that we have. That is a worst case scenario for the general public that would be absolutely devastating to the public as well as the hospital facilities. And that's one of the things we are trying to mitigate by having people get vaccinated to tamp down the pandemic before the variant that we can't control and that is not protected by the current vaccines becomes our reality.
Thank you.
I'd like to speak just quickly from the health department perspective too. I mean, we're certainly not at all like the hospitals, but we had really for most of this pandemic reallocated a lot of staff towards the pandemic response and had to curtail some of our usual public health services And this past month, when vaccination demand went down and our numbers were looking really good, we tried to really get back to full-scale public health services that we had been doing before the pandemic. And now, unfortunately, we're having a discussion about pivoting back in the other direction again. And so worst case scenario in that regard is that some of our other problems, public health problems, such as sexually transmitted diseases, tuberculosis, preventable child illnesses, dental problems that can affect children long term. A lot of these things that we take care of, we're already behind on some of those and having to play catch up. But a lot of those things could continue to get worse. And we would really like to get back to focusing on those things for the overall health of the community.
I'd like to say something as well.
Yes.
I think that a best case scenario is that people do what we know worked before. So the masking, getting the vaccinations, doing the social distancing, being mindful about where it is that you're going. Those things did work. It's, when we lifted those, we started traveling, we started doing all those things, that we're starting to see this surge in these cases again. I think that the worst case scenario is the staff continue to burn out. And I think that we have this misconception that there's always going to be healthcare for us. And the reality of that is, and we saw it in New York, is that hospitals are going to have to make choices. And when it comes down to choosing who is going to get care, who's going to live, who's not going to live, and you're going to head in that direction, I think that people need to start thinking about what they can do to try to prevent this, because that healthcare is not unlimited. There are only so many resources and so many people. And as it continues to spread amongst people in the hospitals, there is still a quarantine time that people have to have. And people aren't thinking about the bigger picture and the ripple effect of what this is going to have on people. You're not going to get the care, and those choices are going to have to be made. And I don't think anybody wants that to be made about their family.
Do any of our speakers have any final thoughts before I conclude? Okay, well, I appreciate everyone joining, our speakers, media. As you can tell, this joint hospital leadership group being together, this situation is dire, and a lot of decisions are going to have to be made over the next few weeks to figure out how to continue to handle the surges that each facility is seeing. So as you can continue to relay to your audiences the importance and safety and efficacy of vaccines, getting vaccinated, wearing masks, and doing all the things we know that can mitigate the spread of this virus, we would be greatly appreciative. We will send a recording of this out to all media here in just a few moments once it uploads. Any follow-up questions, feel free to send to myself, Bob Shepard, Adam Pope, and we'll work to get you answers. And thank you all for joining us today. We'll continue to try and provide opportunities for the media as folks are available. So thank you all so much.
And welcome back to CBS 42 Now. Phil Penarski here. We just heard a very lengthy and very informative discussion from UAB, who were joined by fellow hospital leaders and the Jefferson County Department of Public Health. I want to quickly bring up the Alabama Department of Public Health's COVID-19 dashboard. It's got all the latest information. You can find a link to this over on our website right now as well, at any time of day. Again, this is a live look at all the latest numbers in the state of Alabama in the past 7 days. That big red state in the middle represents the overall level of community transmission over the past week. And as you can see, out of the 67 counties in Alabama, only 2, that would be Bullock and Choctaw, are not considered high risk as far as COVID-19 transmission is concerned. Again, that was almost an hour-long Q&A session with UAB, St. Vincent's, and other hospitals in the Jefferson County area, alongside with JCDH. Some of the main topics, of course, included healthcare officials recommending everybody to get vaccinated. They said at the end that that is the best case scenario for the state of Alabama, who ranks last in the country for vaccination rate, saying that Again, the best case scenario is that more people get vaccinated and the numbers start to dwindle. We have seen a recent rise in cases and hospitalizations, and we've heard over the past few weeks from healthcare officials saying that when the cases and hospitalizations rise, so too will deaths eventually coming. And again, we will have a full recap of this press conference over on our website, cbs42.com, in just a few moments. And while you're there checking that out, be sure to check out our COVID-19 Now special report. It aired in place of the CBS 42 News at 6 yesterday. It was very informative. Art Franklin and Sherry Jackson hosted it, and we're joined by several healthcare leaders, including Alabama State Health Officer Dr. Scott Harris and Dr. Michael Sag with UAB Infectious Disease. We also heard from a COVID-19 survivor as well. It was a very great, very informative 30-minute piece. And then there was also a 30-minute roundtable discussion with other city and healthcare leaders across the city of Birmingham, including Birmingham City Council President William Parker. Again, I highly recommend everybody looking for further information regarding the COVID-19 pandemic as it relates to the city of Birmingham and Jefferson County and the state of Alabama, really, to check it out while you are searching for this, a recap of this entire Q&A session. And that's going to do it for us here on CBS 42 Now. Thank you all so much for watching. I'm Phil Penarski, and I hope you have a great rest of your day.